I had several health challenges. The biggest one for me was when I was diagnosed with diabetes at the age of 40 or 41. And I have a family history of diabetes, so it was very concerning for me to be 40 and have that diagnosis. I also had the diagnosis of high blood pressure. As the years went by and I got older, it felt to me that my illnesses were compounding because I had also then been diagnosed with sleep apnea and I was struggling with acid reflux. As a result of the diabetes, I had to take diabetes medication, cholesterol medication, and another one, I believe. So as the diagnoses started to add up, I started to worry more about my health. That started me to thinking about what can I do to change my situation, to improve my health, and ideally be here longer for my family, my friends, and my children. I didn't realize it at the time, but I was always tired. I always felt tired. I woke up with no energy, and it was really a struggle to get through the day. But I didn't realize I was so accustomed to being lethargic. I really didn't realize that as much of it was coming from the weight issues. The acid reflux made it very hard to sleep at night. The sleep apnea, I learned, caused me to always feel tired. Even when I woke up from sleeping all night, I wasn't really resting. The diabetes had me feeling, I always felt nauseous and just tired, cranky. So as I learned about each of those illnesses and how they affect me, I started to realize I feel bad because I have all these issues going on in my body.
When Pattie and I met, she was dealing with several chronic medical conditions that are directly related to morbid obesity. In fact, that's a very common narrative I hear, as do other bariatric surgeons. When a patient first meets us, they are oftentimes dealing with other things besides just morbid obesity. For instance, sleep apnea, diabetes, osteoarthritis, to just name a few. And Pattie was no different. And since surgery, and since certainly really in the month to almost year since her surgery, she has seen all of those comorbidities resolve, which is what we want to see in all of our patients.
So I followed the process, and at each stage, everything was looking good, and he told me that what his recommendations were, and by the end of the process, everything was approved, insurance, his office, his recommendation of the sleeve. The sleeve is the procedure that I preferred, and so for me, everything was a match, and that's when I said, then I'm going forward.
Patti Teague had the sleeve gastrectomy. A sleeve gastrectomy is where 85% of the stomach is removed. We remove two very important parts of the stomach during this operation, the first of which is called the fundus, and that's where the stomach does the vast majority of its endocrine metabolic communication. So by removing that, we limit the stomach's ability to participate in the endocrine functioning of digestion. And second part we remove is called the greater curve. This is the major capacitance source for the stomach, meaning that's where the stomach has most of its storage capacity. So we limit the storage capacity of the stomach, and we limit its ability to communicate with the endocrine system, which is what leads to great weight loss. It's not really about cutting out the stomach because people can't put down the fork. That has nothing to do with it, actually.
Recovery from the procedure, again, went very well for me. I remember waking up from the procedure. I remember no major pain. Mind you, I had had major surgery before, so with this procedure being minimally invasive, I really didn't register it as pain. I registered it more as discomfort. After being released from the hospital, it just got better each day.
What patients normally say when we first meet is, "Doctor, I'm afraid of surgery," or "I've heard XYZ horror story, and can you help kind of unbox that?" And I think that's a very essential function of the initial consult, is to demystify the surgeries themselves, really explain in understandable terms what is going to happen during the operation so that patients can sort of feel more comfortable about what they're signing themselves up for. And after surgery, patients often say to me, I can't believe how easy that was. And I really think that is, I don't know if I speak for all bariatric surgeons when I say this. That's what we all want to hear, right? Because we see it every day. We're the surgeons. We understand how tolerable minimally invasive surgery is, yet patients have no idea until they've lived it.
Many of the health challenges have subsided. I no longer struggle with sleep apnea. I'm not using a CPAP machine, so that makes me smile. I no longer have to take the diabetes medication, which I hated. And there are 2 other medications I no longer have to take. I can walk. I can walk for miles at one time. I can walk my dog and enjoy it. Before, the back pain would not allow it. The arthritis in my back would not allow it. We have here at St. Luke's Sugar Land Hospital, we have a bariatric support group that recently formed. I'm a member of that support group. I'm a member of a couple of Facebook groups, and I actively participate. I like to share my experience. I like to read about the experiences of others in case it'll help me. And I love to take the opportunity to tell everyone about Dr. Fadner's office. If I had known what I know now about the procedure and the improvements to my health, I would have done it sooner. So I would tell anyone that's thinking about it, don't be afraid, get the information, make sure you're comfortable with the surgeon that's going to perform your procedure, and then go for it, and then go for it.